Hello, my name is Dr. Nick Loloee, and welcome to PI Today's first episode. First, a little bit about myself. I've been in or around personal injury for about 25 years, wearing many different hats as a practicing doctor or a facilitator. Learning a lot from my colleagues that contribute to this vital field that is an absolute necessity for people who suffer from horrible accidents. As anything in life, information is vital for advancement, so we put together this show, PI Today, to bring you the latest medical and legal information out there so you can make an educated decision when it comes to practicing, either as a doctor or a lawyer. Today's topic is very fascinating. We're going to dive into the world of the most mysterious part of your human anatomy, the brain, and how it's affected by traumatic brain injuries. As you know, brain injuries can vary dramatically in symptoms, treatment. So today we have a very special guest to help us on our journey to diagnose and treat some of these people who are affected with this horrible condition. Without further ado, I'd like to introduce you guys to the world famous Dr. Taimoorazy, MD, board certified interventional pain management. Dr. Taimoorazy, welcome to PI Today. You are our first guest, so we are definitely setting the bar high. Dr. Taimoorazy, please tell us a little about your studies and your boards, your training, and get us kind of up to speed.
Thank you, Dr. Nick, for having me, and it's an honor to be your first guest in this very exciting podcast series that you will have coming up in the future. I'm a pain management physician, but initially I'm, of course, an anesthesiologist, triple board certified in the field of anesthesiology, pain medicine, and uniquely subspecialized in the field of headache medicine. I'm also a clinical instructor of surgery at University of Illinois and a fellow of the American Headache Society. So having these different subspecialties really gives me a unique perspective. And I'm basically looking at a patient from like 30,000 feet, and I can basically evaluate this patient who may be suffering from a variety of medical conditions, but because of this unique subspecialties, then one can dive even deeper. From that 30,000 feet, you can dive deep and go into the most intricate abnormalities that this patient may be suffering.
As we said earlier, as I said earlier, talking about traumatic brain injuries and the brain being kind of complicated and mysterious, what is your take on how the brain functions and how a traumatic brain injury affects it?
Well, frankly speaking, nobody knows how brain functions, but we see it's functioning, and then we can see its dysfunctions. So, as we all know, brain is made up of billions and billions of neurons that are connected to each other with synaptic connections, and of course the neurotransmitters and neurochemicals are what makes it all happen. So any disturbance with this neuroconnectivity, with this synchronous firing of neurons in the central nervous system, can manifest itself as an abnormal brain function, whether it could be weakness, numbness, could be, for instance, memory dysfunction, could be a variety of different findings, could be seizures, for instance. Any of these can be a manifestation of an abnormal brain function.
Exactly. So today we want to kind of get a little bit deeper. Traumatic brain injury is very broad and it has many, many tentacles. Today we want to talk about things that we can't see. In traumatic brain injury, 1% or less, you have bleeds. So a lot of brain injuries, traumatic brain injuries, might be looked as subjective. So we want to kind of dive deeper into it. And one thing that really stands out in traumatic brain injuries that I've seen practicing and seen in the field a lot of is one diagnosis which I see over and over again, and that is major depression. That affects a patient who's had a mild, moderate, or even severe traumatic brain injury. And Dr. Taimoorazy is, how do I say, has a goodie bag, literally a goodie bag, how to is a specific treatment, and he's one of very few doctors who has this type of special treatment for the causation of traumatic brain injury, which causes depression. And today we're going to really talk about ketamine. And everybody's heard about ketamine. It might have some stigma or negative connotations. We kind of want to get around the myth, what you hear out, and get a real academic's perspective on how ketamine is used to treat traumatic brain injury patients that suffer from depression. So, Dr. Taimoorazy, please enlighten us how this drug and treatment helps people with traumatic brain injuries, people who suffer from anxiety, might have acts of violence, mood changes, mood swings. I've seen people that their spouses say they're a completely different person after the accident, having a traumatic brain injury. How does this treatment of ketamine, how does it stabilize? How much do you need of it? What are the side effects? What are the benefits? Depending on the severity, how long does it need to be used for? So really enlighten us about this miracle drug that has, is it FDA approved? Is it peer reviewed? Is there articles on it? Has it been double blind studied? We want to get around the stigmas of what ketamine is and really get educated about it, because is it old technology? Has it been used before? Is it a new treatment? So kind of dive us into ketamine.
Dr. Nick, I really have to start first by thanking you for bringing this topic to the fore, because many physicians look at a brain injury, a TBI, as a structural abnormality, and they focus on if there is a brain bleed, there is a fracture of the skull, there is disruptions of the nerves. And in the mix, then there are patients who unfortunately fortunately I should say, don't have much of any structural abnormality, but then their life is all messed up. I mean, they can't function, they can't think. They are foggy. The brain is foggy all the time. The brain is not what it used to be. The wife says, "This is not my husband." They keep taking them back to the neurologist, to different specialists, to psychologists, psychiatrists, and they can't find anything. They put these patients on antidepressants and different psychoactive medications, which, as we know, they of course they have their own place, but there comes a patient that doesn't respond or has side effects, and this patient is really floating, and a lot of bad things can happen to these patients. They may become suicidal. So that is when we come to the picture, and thank you for bringing this topic of ketamine to be discussed. As you said, there is a stigma about this medication, but there is no medication that has no side effects. Even if you take Tylenol, if you take aspirin, you may experience really even life-threatening side effects. Having said that, if any medication is used based on indications, if it is used by physicians who know how to use it, if they are familiar with the side effects or how a patient may react to that specific medication, then it can be used very safely for that indication. So ketamine has been around since, I would say, early 70s. It was a medication that was designed to help combat, like soldiers, when they were injured in the front lines and there was no access to medics and anesthesia to take care of them when they were injured, then they were receiving ketamine, which is a very powerful pain medication, and also at higher dose can be an anesthetic. So fast forward, then gradually we learned about the mechanism of action of this medication, which is a very powerful blocker of a receptor that is called NMDA, which is the most prevalent receptor, which the most prevalent neurochemical, which is called glutamate, it acts upon that receptor. So the function of glutamate basically is transmission of and modulation of pain. So when you block NMDA receptors, you effectively block pain. And that is how it was used, and it is used very frequently in the hospitals. Ketamine is so safe, unlike what a lot of people think about it. For pediatric anesthesia, this is one of the most frequently used anesthetic. You have your child playing on trampoline, they fall, they, let's say, dislocate a shoulder or elbow. When you take them to the emergency room, the ER doctor, first thing that they do, they give them an intramuscular dose of ketamine. The child becomes quiet, sleepy, doesn't feel any pain anymore, and the dislocated shoulder is replaced, is relocated, and things are done. So, but the more we used it, then we learned about what else can come from it. And interestingly, in the last 20 years, numerous studies have pointed to the antidepressant and mood-altering properties of ketamine. And studies were focused on finding out what really is happening in the brain of this affected individual that ketamine works on it. So studies, interestingly, have pointed out that depression, PTSD, and anxiety seem to be a neurodegenerative condition. So people who are experiencing these mood disorders, they have degenerated dendritic connections in their brain. And so the neurochemical that has to be secreted is not secreted enough, or it is not taken up by the dendritic connections. So there you have the symptoms. What ketamine is doing is, within hours of infusion of this medication, you will notice that the dendritic connections are reestablished. So regeneration, which is a beautiful event in the central nervous system. Our brain is equipped with a process that is called plasticity. Plasticity, it means the brain can regenerate, unlike what we thought, that once neurons are dead and that's it, that's the end of the story. But that's not the case. Study after study has shown in animal studies and human studies that once you're exposed to ketamine, the dendritic connections that had degenerated due to either trauma or just the depressive process or PTSD, the connections are reestablished. And once reestablished, the release of neurochemicals, neurotransmitters goes back to normal. And the most important thing that happens is that synchronous firing in that neural circuit is reestablished. And this magical event happens within hours of infusion of ketamine. And I can go so far to state that the American Psychiatric Association has stated that ketamine is the biggest breakthrough in treatment of psychiatric disorders since the introduction of SSRIs like 20, 30 years ago.
That's amazing.
That's amazing. This is a beautiful drug. This is, if it is used properly, it's like a magical drug.
Correct. And depending on, obviously, each patient is not all created equal. So what is the dosage, the length, how many levels of treatment does somebody with a traumatic brain injury suffering from depression, anxiety, pain, fatigue, what is the protocol, which is very important to know, so people out there can make an educated guess about their patients.
Dr. Nick, I have to add to the list of the conditions that ketamine may help the patient headaches, especially after trauma. The headaches, post-concussive headaches, are very similar to migraine headaches. Even the pathophysiology is almost identical. The patient has throbbing headache, nausea, light sensitivity, and they are placed on migraine medications, which a lot of times it works, sometimes it fails, or patient has side effects. We've used ketamine for a variety of these indications, including not limited to, of course, the mood disturbance post-trauma, post-TBI, but also the headaches that are refractory to these conventional treatments. So the mechanism of action, as we said, is it makes changes in the neurochemistry of the brain and regeneration of the brain. For that to happen, the brain tissue, the central nervous system, has to be exposed to this compound, to ketamine, repeatedly. So our protocol calls for a sub-anesthetic dose, which this is where I should make a strong emphasis. When we say we are giving you ketamine, we're not putting you to sleep. You're not anesthetized. You may even wonder if we are giving you anything, because the dose is so small and is given to you over 60 minutes. And patients sometimes they say, "Doc, are you sure there's anything in this IV
And
that you..."
how is it given, doctor? Exactly.
So the way it works when the patient arrives, first of all, they need to be fasting for 6 hours, just like any other medical procedure, pretty much. Then a small intravenous line is placed, and the medication, ketamine, is placed in a small bag of fluid, which then it is infused over a course of about 60 to 75 minutes. The dose is very, very small. It is sub-anesthetic dose. On average, we use about 0.5 milligram per kilogram for that patient. So an average person basically would receive about 30 to 40 milligrams. Just to put it in perspective, when you are anesthetizing a person, and you want, which you can if you give enough of ketamine, then you have to have much higher dose. So the intramuscular dose for ketamine can be 3 to 4 milligrams, and intravenous is about 2 milligrams per kilogram. But it is done and given to you right off the bat. It is not like a slow infusion. So when you need to anesthetize a person, you push intravenously, let's say about 2 milligram, 1.5 to 2 milligram IV push. If your intramuscular is your route of administration, then you need 3 to 4 milligram intramuscular push. So, and then patient within a minute or two is anesthetized. It is a very different ballgame when you're doing it intravenously for mood disorders or headaches. The dose is only 0.5 milligram per kilogram, so it's almost 4 to 8 times less than the anesthetic dose. Plus, it is not given to you as a bolus. It is given to you over a course of 60 to 75 minutes. So patients, most of them, if anything, they feel relaxed. They don't fall asleep.
And is this multiple sessions depending on the severity of the patient's conditions?
Yes, as I mentioned, for the changes to occur in the central nervous system and to be maintained, you need to repeat this. So our protocol is 6 infusions every other day. And now some patients, after 3 or 4 infusions, they feel dramatically like they feel like the world has changed. They're feeling awesome. We don't have to go to all the 6 infusions, but to solidify the gains and to make sure what we have achieved is remaining with the patient for an extended period of time. Usually 6 infusions is probably a good number to look at. And then, of course, patient monitors their psychiatrist, if they are working with one. They monitor the patient's condition.
Now that's a great point. Do you feel it beneficial for psychology or psychiatry while they are getting this ketamine treatment with talk therapy or other medications? Do you feel that's helpful?
Absolutely. So the changes that come with the infusion of ketamine would be absolutely supported by if a psychotherapist is continuing with the patient, if the psychiatrist is continuing with the patient. Many of our patients have even come off of the psychoactive drugs, or they needed significantly less number of drugs or less dosage of the same drugs, because ketamine revolutionized the thing that was happening in the brain. It corrected it so much that patient either does not require any of those medications any longer, or they need much less of it. So
Amazing,
it's an
amazing.
amazing medication.
That is
Yes.
exactly what I've heard over years, and I'm glad that this medication has made it to the forefront, and it has less stigma, or obviously because it works. Um, and Through the course of this treatment, does a patient have to change their lifestyle? Do they have to make any changes to their personal lifestyle, or do they just come in for a treatment and feel better?
The fact that patient is suffering from a psychiatric condition, uh, and the fact that ketamine has helped them, it doesn't mean that ketamine, despite that, honestly, it's a miracle drug. We use it so often in our practice, and many other physicians have also started doing so. But the support that the patient needs from family, the lifestyle changes that they have to make, it is no different for a patient who has received ketamine versus the one who is just working with a psychiatrist. Uh, so the support group is extremely essential for the patient. And I always tell my patients to, if they don't have a psychologist, they have to start working with them despite that they are feeling good. And we're always here to help in case the symptoms return, which then, in that case, patient may not even need the 6 infusions, because we have primed the brain by those initial 6 sessions, which were effective. And if patient, over a course of several months after those treatments, start to feel a little bit down, or become a little symptomatic, we do a booster infusion, just one time, and patient again is fine for several months after that.
Wonderful, wonderful. Well, guys, there you have it. Ketamine with the world famous Dr. Taimoorazy. Dr. Taimoorazy is an academic, and we really enjoyed his time. At this moment, we're gonna have our smoothie guru, Miss Connie Gilroy, make us, myself and my guest, a wonderful, nutritious smoothie, and then we'll come back for part two with other conditions and other treatments with the world famous Dr. Taimoorazy. We'll be back in 2 minutes. And to make sure we keep the tropical theme of health and happiness, we design our studio to reflect it. So at this time, I'd like you guys to meet our natural smoothie mixer, Miss Connie Gilroy. She will be hydrating myself and our guests with her magical natural smoothie cocktails. Connie, what are you going to mix up for us today?
Hi, my name's Connie, and I am your tropical smoothie guru. And I'm here today to make a delicious, vitamin packed smoothie that is going to start your day off with energy, vitality. It's going to prolong your longevity. And I'm about ready to get started. Would you like to watch?
Okay, Connie, that sounds delicious.
Thank you for joining us. Enjoy the PI Today podcast with Dr. Nick and his special guest, Dr. Taimoorazy.
Hello, welcome back. I'm Dr. Nick. I'm here with Dr. Taimoorazy. We just had a short break and had our smoothie guru make us a wonderful smoothie. So, cheers, Dr. Taimoorazy,
Thank you, Doctor, to health and success of for your podcast.
Thank you so much.
Thank you.
Thank you so much. Very nutritious. So, on part two, we like to discuss another mysterious injury that is often missed.